Hi everyone, I'm Dr. Ashley Woyak, and this is our fourth video talking about thyroid dysfunctions and what might be going on with you and your symptoms. So, like I've said, I have had patients who have had thyroid symptoms for years and years. They've gone to their medical doctor, trying different medications, trying different amounts of medications, and they're not getting better. They feel like crap. Even if their lab values are within range, they still feel like crap and they want to know why. So today we're going to be talking about the number one cause for thyroid dysfunctions. It's an autoimmune issue. It's not a thyroid issue. So we'll be talking about that. And unfortunately, with an autoimmune condition, no matter what treatment you're doing for the thyroid, it's not going to address the root cause. You need to address your immune system and what's causing that autoimmunity rather than just giving a medication for a thyroid. That really won't get to the root cause. So like we've talked about before, thyroid starts in the brain. Your pituitary is going to release thyroid stimulating hormone to tell your thyroid to make T3, T4. In your thyroid, you have thyroid peroxidase enzyme, which is TPO. That is what brings like your iodine, tyrosine together to make the thyroid hormone, T4, T3. 93% of your thyroid hormone is T4, your inactive form. You don't really use it in your body. And 7% is T3, your active. That's what we need. Because we don't make enough of the active, our body makes a thyroid binding globulin. This is a protein. What it does is carries T4 and some T3 to liver, your liver, gut, kidneys, and that's able to convert T4 to T3. But the number one issue with autoimmunity is your immune system starts to attack this TPO enzyme, and so you aren't able to make a proper amounts of T4, T3. So that is where you have Hashimoto's thyroiditis, and over like 9 out of 10 patients who come in who have a thyroid or hypothyroid symptom, it's actually going to be Hashimoto's, so an autoimmune condition rather than a primary thyroid issue. Your immune system, so it can attack TPO, but it can also attack TSH. It can attack thyroglobulin, which is a cell in your thyroid. It can even attack T4 and T3. So at our clinic, we look at all of this. We can measure it and see if you're producing antibodies. Then we'll know for sure it's an immune system problem rather than a thyroid problem. I can guarantee you most doctors and endocrinologists that are working with thyroid patients don't look for these antibodies, and we can measure them. So that's something we do here at our clinic. So a lot of you are wondering, well, why would your immune system get overactive or for some reason, attack your thyroid? Well, any autoimmunity, the first organ to get attacked is your thyroid. So there's that. But a lot of times what causes your immune system to become overactive is it can be food sensitivities, it can be infections, it can be dysglycemia, anemia, hormonal issues, especially in females and even in males. And if you're having a poor immune system, that can stimulate it too. So what's your vitamin D, your vitamin A like, your glutathione, your essential fatty acids? So those are all things that we take into account here, and we look at it individually. No one is treated the same. We have to figure out what's causing you and your symptoms. Or your issues, I should say. Like I said before, 9 out of 10 hypothyroid symptoms are hypothyroid disorders are because of Hashimoto's. It's an autoimmune issue, and over 9 out of 10 hyperthyroid patients, it's Graves', so it's also an autoimmune issue. So just a reminder, the number one issue for thyroid dysfunction in patients is an autoimmune condition. It's not a thyroid issue. So I hope you found this video helpful. I look forward to working with you soon. Thank you.